My name is Nimesh Patel. I'm an orthopedic surgeon. I work for Panorama Orthopedics. I specialize in total joints and orthopedic trauma. I grew up in a suburb just north of Atlanta in Norcross, Georgia. I did my medical school in Little Rock, Arkansas. That's where my parents were living at the time, so I went back home to stay there and while I did my medical school. After I finished that, I went to New Orleans for my orthopedic residency. In fact, my wife was doing her training there as well at the time, so we did both our residencies together down there. And then I went to Boston for my orthopedic trauma fellowship at the Harvard system there and finished up my training there. I chose orthopedic trauma because I really enjoyed that type of work. I enjoy fixing fractures. Orthopedic trauma allows you to take care of the patient as a whole. It's not just very isolated to one body part. So that's one of the reasons I really found a lot of interest in pursuing that. Here at Panorama Orthopedics, I have an elective practice that specializes in total joints. I take care of all types of patients who have arthritic issues with their hips and knees. So that allows me to take care of people with even mild symptoms of joint pain, but then if ultimately it becomes end stage or very limiting, it allows us to do the surgery, which would be a hip or knee replacement. And it gives me a nice balance between doing that line of work in addition to the orthopedic trauma as well. I joined Panorama simply because I thought it was a very well respected and well run group. It's a big organization, lots of physicians. They have a large goal, lots of motivation within the group, and all those things attracted it to me. Panorama is not the only group, a large group in the country, but it's a group that also covers a level 1 trauma center, which I find it is difficult to find, especially as I did my training in orthopedic trauma. So it allowed me to join a very well-established group while allowing me to do exactly the line of work I wanted to do. My philosophy for patient care is individualized care. I think in a busy practice, there's an easy tendency to start to group patients right off the bat into certain categories, and ultimately each patient has a little bit of a different nuance to their issue, and I think each patient deserves that attention and care, and I really spend a lot of time trying to focus on that and making sure we give that to each patient. In my spare time, I really enjoy just hanging out with my family. I have 4 little boys, so that keeps me really busy, and ultimately once I'm done with work, there's not a lot of free time to go doing all types of different types of hobbies and activities. Having said that though, I still get times, I play soccer in an indoor league once a week, or sometimes twice a week. Even if I do go biking or hiking, I usually just take the kids with me, and if the little guys are too tired to walk, I just put them in a backpack on my back and I carry them along with me. So I'm still allowed to do all these types of things here in Colorado. I even go skiing with the little boys, and we stay busy.